Stabilize the caudal segment. I'm going to be on the spinous process and articular pillar on the left of C5. Okay, so C6 is caudal, stabilizing, C5 is moving. And I'm going to bring C5 into flexion, right side bending, and right rotation. So it's coming around. I'm going to use my pinky to help it come along. Okay, so that's a nice little stretch. So I can bring him down into flexion because I'm at the upper cervical area. So I can flex, 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 and now I'm just bringing it around. Okay, so I can get a nice little stretch with that. Okay, so I'm stabilizing here, and I'm mobilizing, I'm manipulating with my fifth digit. Okay? Can everybody see that? I didn't hear that.
A lot of energy.
Well, good. Come on in. We need you. All right, one more time. Focus, focus. All right, so I'm going to find C6, stabilize it. I can even kind of position him into a little bit of flexion just so I'm flexing down towards that segment. And then my pinky is going to be the manipulating finger, and I'm going to bring him into a little bit more flexion, right rotation, and right side bending. And I'm just bringing it along so that my pinky is active. It needs to stay active. This is kind of that lumbrical grip. It's stabilizing C6. Okay? Okay, sorry. Problem is I'm ignoring him, all right? And you can't see the patient's eyes. In our clinic, we like to have mirrors, like a standing mirror in each room, so you can actually, I could actually do this technique and observe face, you know, if you're not covering the eyes or whatever. But you tell the patient, I'm going to very gently stretch this joint that's stiff. You don't say, I'm going to manipulate your cervical spine at C5, 6, okay? Because they're like, what? Okay? I'm gently stretching, very carefully, C5, your lower neck here where it's stiff. That's what I tell a patient. Is that okay? Yep, that's fine. I want you to tell me if anything's uncomfortable, and I'll stop immediately. Okay? So that's how I work with it. Yep.
If you're using a pillow barrier, make sure you don't cover their face with it. It's really easy to smother it. So
Oh, yeah. Oh, that's true. Yeah, that one I don't feel like you need the pillow condom as much as whenever it's here. I call it the pillow condom. It's in between me.